I'm Michael Smith of MedPage Today, and I'm here in San Francisco at the annual meeting of the American Association for the Study of Liver Diseases, talking with some of the top experts in the field. With us tonight are Dr. Zobair Younossi of Inova Fairfax Hospital in Virginia. Dr. Younossi, welcome back.
Thank you.
And joining us tonight, Dr. Adrian Di Bisceglie of the St. Louis University in St. Louis, Missouri. Dr. Bisceglie, welcome.
Thank you.
This is a meeting with many topics. Let's start, and I'll ask you, Dr. Di Bisceglie, liver cancer is a major issue, obviously, for hepatologists. What's new at this meeting in that field?
It is indeed a major problem and a rising one. There are more and more cases of primary liver cancer. What I've seen that's new is studies related to the use of the drug sorafenib, which is an oral medication to treat advanced liver cancer. We saw data today on use of biomarkers in serum to see which patients respond best to treatment. The one particular finding of note is serum levels of c-KIT seem to correlate with the best responses to sorafenib. The other study that I think was potentially very important was a study reported from the University of Michigan, but based on a database managed by a transplant network across the country of local regional ablative therapies prior to liver transplantation. This study showed that there seemed to be a survival benefit for these local regional therapies when used prior to liver transplantation for hepatocellular carcinoma.
I see. Dr. Younossi, you've been following these issues as well. What struck you?
I agree. I think sorafenib, especially the targeted therapy with the novel agents that you're developing, sorafenib is one of these drugs for hepatocellular carcinoma as an advancement. I think there are also a number of diagnostic biomarkers that are being developed that are non-invasive and potentially in the future could provide us with more accurate and sort of earlier capability of earlier diagnosing hepatocellular carcinoma, which is a deadly disease in our field.
I see. Well, Dr. Younossi, let's move to hepatitis B. Again, another serious issue, perhaps not as serious as hepatocellular cancer, but still serious. What's new at the meeting here?
I think probably the most important part of the meeting sort of results that I've seen is the long-term data of the new drugs that now have been sort of at least available to us practitioners, that with the nucleoside and nucleotide analogs that we have for treatment of hepatitis B, that some of these drugs, when you follow patients long-term, that we still have good safety data, and that's comforting to a lot of us. And there are some initial data suggesting that in the future we may be able to use combination of different drugs with probably better efficacy, but most importantly low resistance. But those drugs, those combinations are not proven yet.
I see. Dr. Bisceglie, some comments on Hep B?
Yes, well, certainly the long-term benefits of medicines such as entecavir are very important because we may be using these medicines for a long time. I think the other studies that I saw of note in hepatitis B are firstly one in which patients were switched from adefovir, an older drug, to tenofovir. It looks like tenofovir will probably take over from adefovir, and we need to know whether this can be done safely and whether the new medicine will work. And indeed, that was shown to be the case. There was another study of some interest. To avoid this idea of long-term therapy, we think that if patients can be treated to lose hepatitis B surface antigen, then we can stop treatment. And there was a report of combining a nucleoside analog with interferon showing a high rate of loss of surface antigen that I think needs to be confirmed in bigger studies, but is potentially quite interesting.
I think both of these two drugs, entecavir and tenofovir, provide us with really a great armamentarium to treat patients with hepatitis B. The tenofovir pregnancy labeling is a bit more favorable, which is something that would be very important for my young patients who could get pregnant during the treatment. It's one other thing that we've
interesting, and of course tenofovir is well known
right.
From the HIV arena. and has a great deal of patient information behind it, so you know a little bit about the safety. Great. Well, interesting insights, and thank you very much for your time, gentlemen. I'm Michael Smith, MedPage Today.